Okay, I think we're going to get started. My name is Karen Sporn, and I'm a nurse practitioner, family nurse practitioner at Seattle Children's Autism Center. And I'm really pleased to be here tonight. I have a group of the nurse practitioners here with me, and we're going to be presenting on care planning, which is one of the types of visits that we have at the Autism Center. So I'm going to let the three nurse practitioners that are here introduce themselves, but I did want to just mention that we have a few other nurse practitioners that weren't able to come and present, and I wanted to let you know who those individuals are. David Eaton, who's a family nurse practitioner, Jen Mannheim, she's a pediatric nurse practitioner, and Therese Fafizadeh, she's also a family nurse practitioner. So we have a nice group, and we have four of us here today. Again, I'm Karen, and I'm going to pass it over to Dora.
Good evening. My name is Dora Hall. I am one of the pediatric nurse practitioners at the Autism Center.
Hello, I am Caitlin Cotter. I'm a pediatric nurse practitioner at the Autism Center.
Hi, I'm Sarah Twardowski. I'm a family nurse practitioner at the Autism Center.
Okay, well, we are going to dive right in. Briefly wanted to just discuss what the objectives are going to be for our presentation this evening. Primarily, we would like those listening to understand what care planning is at the Autism Center. We will review the essential components of care planning and a care planning visit. We will provide families with guidance to evaluate their child's treatment needs, and we'll provide some information about where to find helpful resources for your child and your family. So to begin, we just wanted to give a brief overview of autism spectrum disorder. Many families that come in for a care planning visit, the child has a diagnosis of autism. So just as a brief refresher, autism spectrum disorder is classified by having challenges in two main areas of development. And those areas are the first area is social communication and social interaction, and the other area is having patterns of restricted interest and repetitive behaviors. In order to have a diagnosis of autism spectrum disorder, children must have challenges in both of those areas in order to meet criteria that are put forth by the Diagnostic Statistical Manual 5th edition, the DSM-5. So to briefly go over the social communication impairment, there are three areas within social communication that children have to have difficulties in. The first one of these is social emotional reciprocity. This refers to the back and forth of social interactions. This can relate to having back and forth conversations, with sharing interests and enjoyment, bringing toys to show, as well as showing empathy, perspective taking, which is being able to put yourself into somebody else's shoes, and how we relate to each other. So children have to have some level of impairment in that within those items. The second part of social communication is nonverbal behaviors. This refers to the way that we communicate without using words. This refers to eye contact, use of gestures, use of facial expressions, use of body posture, as well as recognizing those in others. So recognizing others' facial expressions, recognizing the nonverbal or social cues of others. And the third area in social communication is developing relationships. So children have to have some level of difficulty in the way that they are able to make friends, whether they show interest in peers or show interest but have difficulty connecting with peers, difficulty engaging in cooperative or imaginative play with others. So children have to have difficulties in all three of those areas. Then to go through the restrictive and repetitive types of behaviors, there are 4 areas in this domain, and children have to have difficulties in at least 2 out of the 4 areas. One of those areas is having stereotyped or repetitive types of behaviors. This can be in the form of repetitive movements such as hand flapping, rocking, spinning around, It can also be repetitive types of speech patterns, reciting lines, using learned phrases or scripted phrases from cartoons or movies. And then the second area is having kind of rigidity or inflexible behaviors. This can be children that really need to have a routine, having difficulty with routine changes, difficulty with transitions, having certain things that have to be a certain way in order for their kind of their day to go well. The third item is having abnormally obsessive interests. This could be really focused interest on one topic, just wanting to play with one type of toy, and that's the only thing kids want to do, being really focused on one part of a toy, such as spinning the wheels of a car. And then the fourth area is having sensory differences. This can be in the form of being sensitive to sensory input, sensitivity to sounds or lights or smells, or it can include sensory seeking behaviors, such as being really into moving their body against things, or really liking the feeling of their hands getting dirty or messy.
So what reasons would there be for someone to come in for a care planning visit? Oftentimes, families are new to a diagnosis of autism and may have some questions about what that means. Some families have had that diagnosis for years, but are experiencing new concerns or questions related to how their child presents with autism spectrum disorder. And so when we first meet that family, we hope that they come with a list of questions for us, which will be the first thing that we probably address in that visit. So, suggestion, bring a list. We also want to talk about overall goals for the future. What is your long-term plan for your child? And what are your child's long-term plans for him or herself? This is generally not the time to question a diagnosis of autism. Most of the time, we don't make a practice out of taking away a diagnosis. Usually we want to try to work within that diagnosis to figure out what's going to be most effective in supporting your child in however they present with their needs. So common concerns and questions. Just some common things that we hear from families. They want to make sure that their children are in the right programs for them. They want to make sure that their children are receiving the right types of therapies and that their therapies are focused on the right goals. They want to make sure that their children are medically cared for. And a lot of families have questions about what kinds of medical testing their child might need in the context of autism. They may need help with common problems associated with autism, like difficulty sleeping, restricted eating, difficulties with toileting, or potty training. There may be behavior concerns, problems with aggression, self-injury, safety awareness. Mental health concerns are also common in children with autism, questions about ADHD, anxiety, or depression. Oftentimes families ask, do we need medicine? Do we need extra supplements? Is this something that we need to be talking about? Or my child is on a certain medication, and is that appropriate for them? And then just questions about general resources in the community. And the last one on there is questions about FMLA, because a lot of families find that they are taking time away from their jobs in order to care for their child.
Okay, so now we'll go into some of the usual components of the visit, going beyond that. So first we talk about health history. So first, why do we even gather a health history? This is important to differentiate issues that might be related to autism versus something that might be due to something else in their medical history. To give correct guidance for recommendations, moving forward to identify any gaps in care with specialists or primary care, and then future monitoring of any health concerns that we identify so we can keep an eye on those moving forward. So the first part of a health history really includes the birth history. During this part, we'll talk about any complications during pregnancy or birth, any prenatal exposures. This includes exposures to alcohol, drugs, tobacco, medications, the gestational age of the baby. An example of this is premature infants might have delayed milestones, so that's something that we'd want to be aware of, be expected of anyway. What was the birth weight, and how was the first few months of the baby's life? Did they grow okay and eat okay? Did they have any infections? And then we want to know about any hospitalizations, significant illnesses, any injuries. Something that we notice is prolonged hospitalizations may cause regression in development, so that's something we would want to know. Mm-hmm. And then we also ask about any prior evaluations and diagnostic studies that have already been done. An important part of this is knowing where and when the child was diagnosed and who diagnosed them. We would want to know any medical specialists that they're followed by. Many children with autism are followed in neurology, genetics, gastroenterology, psychiatry, sleep clinic. These are just a few common ones that we see. And this really just helps us coordinate care and know of any gaps and where to refer if needed. Then we would want to know any prior developmental assessments, including speech evaluations, occupational therapy, physical therapy, any educational assessments. This allows us to review the IEP or the individualized educational plan, and any cognitive testing that may have been done. Any psychiatric assessments to be aware of any diagnosis of anxiety, depression, ADHD. Any hearing assessments that have been done just to rule out a dual diagnosis. Any diagnostic imaging that may have been done in the past, such as a brain MRI, any genetic testing that has already been done. And knowing all of this just gives us a chance to review the records and to all be on the same page, just help us be able to make the best use of time and recommendations moving forward.
So the next component that we may be asking about in a care planning visit is called a review of systems. That basically means that we are going to be asking questions about any current concerns related to various body systems. And the reason that we do this is to determine if the child has any current medical concerns that are contributing to the overall picture of what's going on for this child and family. And often when we ask these questions, we focus on the common medical issues that we might see in autism spectrum disorder, and we also focus on any concerns the family may have. So when Sarah was mentioning about in the very beginning of the visit, we ask the child and the family why, what their goals are for the visit. Sometimes for families, it's one of these questions that we ask. It may be one medical concern that is their top priority, and we may spend a majority or an entire visit focused on a single medical topic. So some of the common areas that we ask about are general growth. So are there any concerns for weight gain, weight loss, any concerns that a child may be falling off the growth curve or kind of accelerating on the growth curve faster than is expected? Are there any concerns for head size? A very common area that children with autism have difficulty with is the area of sleep. So we ask lots of questions around sleep, whether there's difficulty falling asleep, difficulty staying asleep, whether children may be really restless or if there's significant snoring. Difficulty with sleep can really affect a child in a number of ways. So families come in with that concern, and then we ask lots of questions around that. We then ask about GI complaints. Constipation is very common in all children, certainly common in children with autism as well. We ask about diarrhea or stomach pain. We often spend a lot of time talking about eating habits. It's common for children to be very picky eaters or have very specific rigidity or rituals around food. Some families may be concerned about children eating non-food items, eating things like chalk or wood or putting everything in their mouth. And we also would ask about food-seeking behaviors. Some children who have a hard time stopping eating. So we'll ask lots of questions around that. We also want to highlight any hearing or vision concerns. As Caitlin mentioned, if there's any hearing concern, we want to make sure that we can get that tested to rule out any additional medical hearing concerns that may be contributing to the overall picture. And we would ask about any concern for seizures or staring spells. And then there are other items that families may bring up that they may be concerned about as well, and we make sure to cover those.
So I just wanted to talk a little bit about what the physical exam looks like at the Autism Center. We don't have a physical exam. So like when you go into your primary care provider's office, oftentimes there's a physical exam associated with some sort of illness or wellness visit. But at the Autism Center, we don't specifically do that. We do much more of a kind of an observation, which is really an examination from the time that we see the child in the waiting room all the way to the end of the visit. And it's really nice at the Autism Center that we have, it doesn't look like a clinic necessarily. It's much more of a kind of a supportive space for families and kids, because we know that a lot of kids that come into the hospital or into clinics who have autism, and kids who do not, really don't tolerate that space very well. So it's an inviting space. So we don't have the typical clinic examination rooms. We have a few of those, but most of the time we're seeing kids in our offices. So when we have kids that come in, we do observe them, like I said, and we're looking at the health and the wellness of the child, but we're also really observing looking for things that are characteristic of autism spectrum disorder. So there will be a small piece of examination related to measurements like height and weight and sometimes blood pressure. But a lot of the times we're looking at other things like how kids are moving, how are they using their body, does it seem developmentally appropriate, are there delays with walking, running, getting from the waiting area to the office. How are they communicating with us? Are they using words? Are they not using words? Are they using other forms of communication like eye contact or gesturing? If they do have words, we're really trying to communicate with the child, him or herself, to see, are they being able to interact? Are they asking or answering questions? How are they responding to their parents or caregivers or family members? How do they play? We all have toys in our office, and so we're looking to see, are they playing with toys the way we would see kids play with toys, or are they doing kind of repetitive movements or manipulating toys in a different way? We do look at the overall child to see what are their facial features like. Is there anything that stands out to us in that regard? And then other kind of autism-specific characteristics. Do they have any repetitive movement, like hand flapping or toe walking? Or how do they transition? How do they get from the waiting area to the office space? Is that difficult? And all of this gives us a way of kind of determining how the child is doing, just in health and wellness, looking at that child, but then also how is autism spectrum affecting that child? And that's what we consider to kind of be our observations and examination.
So in addition to observing your child for where they are in their development, we're also going to probably be asking a lot of questions to the parent about what your child can do, and in order to get an idea of where they are developmentally. So We're probably going to ask a lot of questions about how their autism is affecting their daily tasks. Do their symptoms interfere with their ability to perform daily tasks? And so we're going to ask a lot of questions about social skills, such as conversations, asking for help, building friendships. How are they interacting with family, friends? We're going to ask about repetitive behaviors, difficulties with change and transitions. Are they really literal thinking, really literal thinkers, and that maybe gets in the way sometimes? Do they have really restricted interests that are taking up all of their time and interfering with their ability to complete schoolwork or something? And then other areas of current development, such as their motor skills and self-care skills, in order to determine current functioning and how we can best support them. So again, we talked about life skills, bathing, dressing, feeding. Can they solve problems on their own? Can they make choices? Are they happy with their choices? Are they aware of safety issues? Are they running out into traffic? Are they doing things that seem really dangerous to others, but they don't seem to recognize that it's dangerous? Are they keeping up academically at school? And we're also going to ask about behaviors. So is there significant difficulty with temper tantrums or other challenging behavior? What are the triggers? What have you attempted as far as management? What's your goal for managing behavior? And how can we help you then meet those goals? All right. So we're probably also going to ask about your child's mental health, determining what, if any, mental health problems may be affecting their skills, learning, motivation, and behavior. So mental health concerns are common among children with autism. We may see things like depression, anxiety, mood disorder, challenging behavior, ADHD. And so if you bring up a concern like that, we're probably going to ask, is that child currently being treated for any of those concerns? Who's treating? What have you seen as far as response? And then evaluating overall mental health. What is their usual mood? Is their behavior predictable? Have you seen a change in their behavior or their life skills? Their ability to perform life skills? Any recent changes to routine or environment that may be contributing to their mood or mental health? And the reason we ask about those things is because oftentimes kids who are experiencing mental health challenges may be experiencing their ASD symptoms in a more significant way or in a different way from what we would see as their baseline.
And I also wanted to point out that, we see kids who are as young as, little people, 18 months, all the way up through, 21, 22 sometimes. And so really, we are talking a lot with parents and caregivers, but we are also really trying to make sure that the child or the individual who has autism is letting us know to his or her best, the best of his or her ability, what goals and challenges that child might face too, just depending on the ability of the child. So yes, we're doing a lot of interviewing, and lots of times it's primarily with the parent or the caregiver, but also we are trying to make sure that the child is feeling supported too, because it can be a big appointment. We're asking lots of questions. So the other big piece that we talk about is education, and again, this is always very specific to each child, depending on where the child is in her educational experience, but then also just what the needs may be. And so we're going to ask about where the child is in a classroom setting, general education versus special education. Has the child been evaluated for special education? Some kids haven't been yet, and we know that with the diagnosis of autism spectrum, oftentimes it is important to have an assessment if there's concerns not only related to learning, but social skills or social communication deficits, adaptive concerns, etc. So we're really trying to kind of figure out what the child's education plan or program looks like. Again, we're not educators, but oftentimes this is a big concern that comes in to the clinic, lots of questions related to this. So we do often spend a lot of time trying to figure out what the plan is, where the successes are at school, but then where the challenges are, so that we can work with the family on kind of advocacy resources at the end of the visit. So after we've done all of this information gathering, a lot of the visit, at least half of the visit, is observations and then lots of information gathering. So from there, we are taking all of that information that the families and kids share with us, and together we're kind of coming up with a plan. And again, this is very, very specific, based on, first of all, the kind of questions or concerns or goals of the family, but then also what we're seeing that's kind of rising to the surface in terms of what the family might already have in place, but then what might also be needed. So the recommendations that we might come up with are kind of health recommendations. So Dora talked a lot about some of the kind of the concerns that we often see and often hear about in kids with autism, whether that's sleep, constipation, or other kind of gastrointestinal issues, physical activity, and we're working with the families and with the kids to make kind of specific recommendations related to that, related to sleep hygiene and whatnot. But then we might also be thinking about ways to connect kids and families to other more specialized services or therapies to treat those things, whether it's like the sleep clinic at Seattle Children's or going back to the primary care provider to talk more about sleep. The kind of the medical concerns or questions that come up, sometimes that's related to lab work. A big example would be one of like sleep. Again, this is a common concern for families because it impacts the child and then the family dynamic as well. And so oftentimes we're working with the family to go back to primary care or come here for labs to look at, what does their blood count look like, and is there anything that might be attributing or associated to the sleep problem, like restless leg and insufficient iron or something like that. So those are some of the kind of specific lab recommendations we might make. And again, we work really closely with the family to figure out where the best place to get that done would be. We certainly are making recommendations for referrals, like I mentioned, both medical, but then also other types of therapy referrals. I think I talk about that in the next slide. Did I do that? One of the slides got removed. But some of the referrals that we would recommend are related to maybe the delays or the deficits that we see. So whether that's speech and language referral or occupational therapy or physical therapy. So occupational therapy would be for like fine motor delay or sensory issues. So we have some of those supports in the Autism Center, but oftentimes it is much, much, much more convenient or accessible to get those services in the community. And so we're often making the referrals or making the recommendations or sending the referrals to a clinic closer to the family's home. Like I mentioned before, we are talking with the families about education, because this can be a big concern. And so we might not specifically make recommendations related to like, okay, well, you need to get additional such and such in your IEP, but we're certainly steering families towards the resources that are available in Washington State to help with educational advocacy for kids on the spectrum. And that can be really helpful for families, I think. We have, other types of therapies that we might be recommending, ABA therapy, social skills groups, both in school, both outside of school. We have a great resource directory and online kind of web-based resource guide that we're often kind of steering families towards, that is helping families connect to things in the community. And we also have kind of family services team that will help families connect to services if there's questions or concerns. Some of the resources on our website are, the autism blog, the 200 series, like this particular lecture. We have many, many, many lectures that have all been videotaped and are available for viewing on our website. So I just briefly talked about the family services team, and we do have a family services team that we collaborate with pretty closely, and here is kind of a list of some of the things that they either kind of provide support for families with, or they have on our website that we're kind of revamping our website right now. We have a lot of these services in place, but we talked a lot about these already. So again, like in a nutshell, just thinking about the recommendations are very specific to each child that comes in. They're thought about, after we get this information gathering, and then we come up with the plan, and we kind of prioritize and then move forward. The other thing I wanted to mention is that, like I said in the just a few slides ago, is we do see kids, little kids, and then we do see kids as they grow older. And I think that is one of the really fortunate pieces of our center, is that we have a lot of families who have young adults who are transitioning into adulthood. And so we try to make sure to work with those families and those teens as they transition into the next stage of their life. And, we have some workshops for families related to transition to adulthood. We have a transition team that really does work with older individuals and their families. And these are some of the supports that we currently offer for those families. Again, our family services team is working very closely with providers and with other staff to make sure that that we can support those families as they move into that next stage of their life. Do you all have anything to add to that? Okay. So I think for the take-home points is that, again, the care planning visit is very specific to each child and family that comes in. And we really view it as a very collaborative process with the child, the family, and then the whole team. So it's us, we as providers, but family members too, and primary care and other staff at the Autism Center. And we're just trying to, really get a good sense of what your child's strengths and challenges are, his or her health and wellness, and then, what are the kind of characteristics of autism, and how we can support that child and your family on your journey. Certainly, this is the first visit, and it's a big visit, and it's more than likely that we're not going to address all of the concerns in that first visit. but we definitely try to do our best, and that's why we often like to have families come with a list, because then we can really kind of tackle the big questions or concerns in that visit and then work towards the others in subsequent visits. We definitely like to collaborate with primary care because, again, they're also a part of the team and they know your child well. They follow your child on a yearly basis, if not more. So it's important to keep that provider abreast of what's happening. And we do find that it's really helpful for families and for us to kind of support as needed over time. And this, again, looks very different for each child and family. We like to have the care planning visit, and then we might, have you come in once a year to check in, or maybe even more frequently if needed. But again, it's very specific to the family. And we really try to work through challenges, but it's really important for the family and for us to also really celebrate the successes, what has helped, and what is your child doing that's amazing that, we can celebrate. So those are the take-home points that we want to make sure that we convey to you. Anything else you want to add to that?
Yep, I think we can open it up to questions, and first we'll take questions from the, oh, there we go. Okay, now we're ready for questions. And first we'll take questions from people that are here in the room, and then we will take questions from those that are watching through Facebook Live, if there are any. Yeah. Mhm. Hold on. There's a microphone coming your way.
So could you please tell me what the acronym FMLA means, please?
Oh, yeah.
Oh, sure. That's Family Medical Leave Act. So that is a federal law that allows for family members to take time away from work without penalty in order to care for a family member or themselves because of a medical or like other health-related issue.
Great question.
There's something that you mentioned, and it was on your slides. It's called staring spells. What is that?
Staring spells are can be a type of seizure that we potentially ask about called an absence seizure, where oftentimes people think about seizures as children having lots of movement, but there is a type of seizure where children can be still and they stare off somewhere, and that can be a seizure. Now, at the same time, it's common for children with autism to not always respond to their name or not pay attention to what's happening around them. So we will ask questions in order to differentiate some children that have staring spells that are related to not paying attention versus staring spells that are related to having a seizure. Great question.
Is that similar to, well, maybe not similar, but to me as a parent, to a kid who hyper-focused? For example, my kid, he's 14, recently diagnosed, and he was reading a book, and I was basically asking him to read it because he needs to practice Spanish, which is his second language. Anyway, so he was reading it, and it was not that long, but he was staring at it without blinking. And I had never really watched him read, and he was just completely, he was focused on the book, but he just was not blinking at all. And I thought that was kind of odd. And I also noticed if he's playing computer games, it's a very specific kind of stare. And anything can happen. He does not know that I'm talking to him. I literally have to move his leg or something to stop whatever. And even then, he still will not look at me. He will listen and he will speak back, but just not look. So anyway, so I just curious.
Yeah, I think that is exactly as you described, that hyper focus of children can get really focused on what they're doing, and it affects their ability to pay attention to what's going on around them. Yeah.
This was so thorough. I really appreciated, and a lot of it. I think I've been exposed to several of the things that were shared, but I would just like to ask you, as far as Children's Hospital here, and I do believe that my grandchild has come here more in a crisis situation to the ER and has been, housed that way. And I don't know, so how, I guess I'm just asking, in the big picture here, at what time, I mean, you guys wait for the, the complete what, 5 to 7 day stay, and then they go home, and at what time do the visits come back to you and kind of start to lay a baseline, or does that make sense? And because do you deal directly during crisis times with your appointments, with the plans?
So I would say that we are an off-site clinic, so we don't really have the capacity to deal with kind of the urgent or emergent crisis. Unfortunately, we just can't do that. But what typically happens is after the diagnosis occurs, whether it's in the autism center or in a place outside of the autism center, you can kind of establish care with us. And then we do see kids ongoing. And in the event that there's a crisis, they're kind of supported by a team, in the hospital. But after the child is discharged, then generally the plan is, to follow up pretty quickly with both primary care and with us. And so ideally the child would already be kind of established, like your grandchild would already be established with one of us or with another provider in the autism center. And then after that, shortly after that stay, they're coming back to see us. And then we're working out, what's happening, what happened, how can we support you, how can we connect you, that type of thing. Does that sound about right?
I'll add to that, in general, when a child who's already established care with one of us is admitted to the hospital in a crisis, we're usually notified of that, and the care team here is pretty good about keeping us updated on what's going on.
Mm-hmm.
So we're going to get started with the questions from our followers who are watching on Facebook right now. And we have a couple questions from Polly Johnson. So I'll start kind of with our first one, and actually pairs pretty nicely with that previous question that we had. So Polly is wondering about when it comes to autism care planning, when your child is escalated and having behavior challenges, especially more violent and extreme behavior challenges, she's found that they've been kind of pointless because they are, when her child is having one of those episodes, she's kind of getting the runaround of, we can see you once the behavior has kind of paused. And so she's really looking for, during kind of those crisis situations, what is the best resource for her to seek care for her son? That may be outside of your scope, so just to acknowledge that as well.
So during
her
escalation,
when there's extreme behavior, she's kind of getting the runaround of directions of the people can't help until the behavior gets better.
Who is she calling?
When she's trying to have a primary care visit, so when her child is having kind of those escalated behaviors and she has one scheduled, that she's
in the autism center or somewhere else?
I don't know. I'm
Okay,
sorry.
that's okay. We can speak to what happens
with any child
within the autism center. If there's a child that's established within our center, if they are having if there's some concern for escalation of behaviors, often we have families call our center. We also have a medical team of nurses that field and triage questions, and they are super knowledgeable in terms of kind of getting an idea of what is going on for the child and family, troubleshooting, kind of giving suggestions of, asking about what care providers they have outside of the autism center as well. We, as the medical nurse practitioner team, we are not behavior specialists. And so we would not be able to have a child come and see us and actively give behavior therapy. But through our team and through our medical team of nurses, families are able to call, and our nursing team, or then through us, whenever a family calls and speaks with our medical nursing team, they also notify the child's provider, if that's one of us or anyone else they may see in the autism center, of what's going on, and we may have some back and forth feedback for the family of things that we might recommend. And we always will say, if there's a crisis situation, if the child is at risk of harming themselves or harming others, if the family does not feel safe, we recommend that they do bring them to the emergency department or call 911 if they're not able to transport the child safely. I hope that answers the question somewhat for Polly.
Thank you. And then I'm going to ask one more question from Polly. So one of her questions, she's always been wondering about if her child had a brain scan, can there be anything possibly found having to do with autism and the violent behavior? And I'm, again, may or may not be outside of your scope, but just worth the ask.
Mm-hmm. No, I think that's a great question, because we do get a lot of questions related to what types of imaging should kids with autism have. Should they have MRIs? Should they have CT scans? If they have a hard time communicating, or they have challenging behaviors. And I would say that as medical providers, we've kind of come to a consensus that the majority of the time we're not going to necessarily recommend imaging for a number of different reasons. There's risk to imaging, first of all, especially if you have to put a child under sedation or anesthesia. You really want to think about the risk that entails, because most of the kids that we see can't tolerate being in a type of imaging machine for the time that they need to be still. And lots of times we would order these imaging, MRIs or whatnot, and the vast majority yield nothing. Nothing comes back. And so when we're going to be ordering imaging, it's generally, we also have neurology and neurodevelopmental peds on staff, psychiatry. We're kind of thinking about the reasons why we would do that. And oftentimes it's related to something that might be like a big regression, a loss of skill, like whether at baseline the child is doing something and then there's a big drop in the ability to do that. And that's when we might think about either referral to a specialist, neurology, whatnot, or imaging, working with our partners. But I would say, generally speaking, we don't recommend that type of imaging.
And I would just add that sort of the pendulum has swung. Mm-hmm. So for those of us that have been doing this for a long time, there was a period of time where the standard of care was to order a brain MRI on almost every child with autism. And I think then, as Karen said, what we found is the yield was very limited. We barely ever found anything that was worth then thinking about going through that, as Karen said, for a child and a family. And when Karen was also talking about how we do our observations and physical exam and really asking about medical concerns in our visit, that's also part of what we're evaluating, is if there's any kind of real flags or concerns that we see in a child that might warrant us considering imaging.
Thank you. I'm going to go just to pivot back so that I can answer the question as well, when the nurse line that you mentioned for the Autism Center for established patients, where would someone find that number? Is that on the Autism Center website?
I believe it is.
Yes, and through the main Autism Center phone number, there's
Okay.
an option when you call the main Autism Center line. If you would like to speak to scheduling, press this number, and one of those options is the nursing team.
Wonderful, thank you. So that's great for Polly to know and others who are tuning in. The next question we have is from David Eaton. And so he is tuning in with us tonight. And his question is, how do you balance therapy options? Who gets a speech therapy recommendation? Who gets an ABA recommendation? Who does social skill groups? So great question from David. Yeah, I can say wave and hi to David.
Hello, David, in the audience.
So who gets what referral is the question. Okay. So typically, my way of deciding that is looking at what are the child's strengths and weaknesses, what are the goals of the family and the child for where they are finding, where they're finding the most challenges, and then you know what does my assessment say, right? So there are times that sometimes I think one referral might be most beneficial for a child, but the family's number one concern or wish or goal for their child is something different, and that might change the way that I refer. And I mean, it's really very individualized how we decide and what we think each child might gain from each therapy, and what that child's ability to participate in each therapy is too. So I think if there are some kids I think might benefit a lot from occupational therapy, but they really hate it and they won't participate at all, and so it's not benefiting them at all. And so we might instead look at some other options to meet those same goals.
And I would add to that as well, is we really take the entire family into consideration when making recommendations. So we can look individually at the child in front of us and say, this child would benefit from A, B, C, D therapy or intervention. But it's important to look at the whole family, because we may recommend a therapy, but the family has to be available to take that child to therapy. There are transportation questions. There are, work questions in terms of when the family is available. So we take all of that into consideration and really individualize a plan for that child and family, and really help them to prioritize among this wealth of kind of potential options that are out there. Great question.
Thank you. So next question from one of our Facebook viewers. So this is from Carol Alreed. And her question is, does the clinic have a care plan template that families can use to share information with caregivers and others?
It's a great question. I would say that there's not one that's just kind of a generic template. It's just we do have a clinical note documentation that we write up and then send to the family after the visit. So that happens, but we don't have one that they could potentially fill in.
No, there is. I don't know if they're still available through the hospital. I don't know if she's also potentially referring to a care organizer for their child. So some families, I don't know if it's on the main Seattle Children's website. Is it still, David? Okay. Even if you search for care organizer, there's a way to print out various papers that help to track information about that child's medical history, medical recommendations, therapy recommendations, school recommendations, and it comes in a binder, or they can potentially access that binder from that's the main hospital website. That's not specific to the Autism Center. I'm not sure if that helps that question as well.
So this is also from Carol, and you may have answered this question when you said if your child is in crisis to please bring them to the emergency department, or if it's unsafe to transport, to call 911. But she is wondering if a parent indicates that their child is in crisis, where is Children's referring them to? What hospital or facility are they being referred to?
That's a great question too. I think it partly depends on location. Often we would recommend that they go to, if there's a crisis situation where we would recommend going to the emergency department, we would recommend that it's probably their nearest emergency department. And if they are calling 911, then it would be the nearest response team that would arrive. Right?
Mm-hmm.
Okay, continuing down the list of questions. So the next one we have is from Fabiola Solis. So Fabiola, I hope I got your name correct on that. She says, hello, I had a question. My son just turned 14 years old. We visit the Autism Center once every other year. My question is, should I make an appointment to have him seen for help for him with his transition to adulthood? And body awareness, can you help with resources or services to help him with everything that comes with all those changes, bit of anxiety?
Yes, please come.
Yes, yes, that's a yes. So certainly make an appointment if they already see one of the nurse practitioners. There's a few of us that work on that transition team. I do, David does, Therese does, and so they can either ask their provider to put the referral in to see one of us, or they can just call and say, I need a transition planning appointment, and then we'll start that ball rolling.
Wonderful, thank you. So that is all the questions we have kind of from those watching via Autism or via Facebook Live. Do the people in the room have one more?
Many places are being, families are being put on long waiting lists. Are you, any of you, still accepting new patients? And what is the space for other people?
Great question. And yes, you're absolutely accurate. Unfortunately, there is a very high demand for services everywhere in this area and throughout the state, and the demand kind of outweighs the supply. So, I mean, there's we have a long waiting list. We do accept new patients, but there often is a very long waiting list. One of the things our scheduling team tries to do if a family calls in is give them a what to do while you wait, or possibly refer them back to their primary care provider to at least ask some of the questions and see if the primary care provider can address some of the concerns, and then go from there. Also, I guess, advocacy and legislation is a whole nother topic, and I think there's some 200 topics on that of making things, making those waiting lists be less than they are now.
Are you able to share anything that the Autism Center is doing or has possibly in the works to expand access either to providers to be able to consult with the Autism Center team, or just alternative methods to seeking resources and through the Autism Center by those who aren't able to be seen in person?
So,
I mean, I would say that we are doing, one of the goals, I think, of the Autism Center is to really try to, like we've been talking about, collaborate with primary care. And that means going out into the community and kind of statewide and doing, kind of training and education related to autism spectrum for primary care providers and other like therapists in the community. I mean, we.
Jen is working on
Mhm.
some of that right now, and Dory, you've done some of that in the past.
Yep, there have been groups of us that have visited various communities that are interested in kind of knowing more and being able to provide care more locally. So there's a bigger group that's focusing on how we can make that really effective, and to where if we do a training in the community and help train primary care providers or other providers to have them then be able to feel confident in providing care for this population. So that's definitely in the works. We have a team that's at a training right now about that in Albuquerque,
Mhm,
I think.
something,
So,
yeah.
so yes, it's in the works and constantly evolving.
Do you have any like list of books or things that parents can read? I mean, you might. I honestly have not explored your website, so it's just a question. And also, I think depending on the age of the child, it's like a whole different ball game. It's like
Oh,
when you have a
yes.
14-year-old versus a
It really
5-year-old
is.
or a 21-year-old.
Mhm.
Very different. So, just curious.
Yes, so on our website, we do have, if you go to the Autism Center website through Seattle Children's Hospital, there's an area for patient and family resources, and within that, there's the Autism Center resource guide that brings up a PDF of an A to Z list of a variety of resources, and one of those resources is a list of books. Now, and you're right, those books some of them might be more targeted toward younger children, some might be targeted toward children that are getting ready to transition to adulthood. So there's a wide variety, and that resource guide is not all inclusive or all exhaustive, but it might give a starting point of where to look for some of that information.
I will say a lot of times during the care plans that I do, families bring up certain topics that they're concerned about, and I'll make recommendations for books based on their like individual needs too, right?
Yeah. That it?
Other questions? Okay. Good. Well, thank you everyone for tuning in and for your great questions and for listening in today.